Hi, mimi naitwa Olive Wambui kama Anti-WA Condoms and I operate in Embu County. Mimi ni msee wa huku, mtu wa huku, nalelea huku, nafanya job huku. And I'm a social worker, social scientist, human rights defender. Yeah, na sahi niko kwa movement yenye ina address the faults and failures by citizens and also government, especially government. Yeah. Na kitu ya kwanza tumenotice ni for the last 2 months hatujakuwa na condoms huku Embu County. You know, hao watu immediately the finance bill ilikuwa rejected, they had a summit, an invite only summit where they called whomever they called in the health department. They say they had young people, but I wish to categorize them as people who would say yes to anything that is giving them money, kama DSA. And I'll explain why, or rather you'll understand why when we are done with this conversation. Walienda, wakasema there are going to be new changes in the health department or sector, that services will be integrated good. But now here comes the challenge. When these services are becoming integrated, the donors who is PEPFAR are pulling out. Hawatakuwa wanatupatia funding ya HIV programming. So government iko on a journey to self-reliance, especially in HIV treatment, care and prevention. Challenge ni moja. Number 1, HIV negative persons will be queuing kwa side ya where the services za HIV ziko integrated. Tuseme kama ni kule kwenye kunaitwa CCC, the Comprehensive Care Center. Let's assume it's still going to operate. Apange line hapo for like an hour, apimwe, apewe counseling, alafu aende OPD kule kwa pharmacy. Apange line tena. Kumbuka, this is a public facility. Public facilities rarely are they empty, even on public holidays. So anatoka kukiu kule, aende akiu kule. Already that is discrimination. Why are HIV positive persons getting treatment integrated at one facility, alafu HIV negative persons wanaambiwa ati nyinyi tunajua mpendi kuonekana CCC, so endeni OPD mtakuwa mkichukua dawa zenyu huko. You spend twice the time to get there. You judge yourself. You feel like you don't even belong in that category. Now that is not how we are supposed to be doing treatment ama prevention ya HIV. Because hiyo ni kueneza stigma. If not stigma in the community, self-stigma. Kitu ya pili, the government is saying they want Kenyans to get used to buying their own condoms. As it is right now, MOH is dealing with new cases za teenage pregnancies zenye ziko on the rise. Now that is happening when condoms have been available. Now imagine that situation when condoms are not available. Mimi am a university student, niko na 200 budget ya kutoka asubuhi mpaka jioni. Hata nimejaribu sana, I think hata over budgeting, maybe 100 budget ya kutoka asubuhi mpaka jioni. I am also sexually active. Sawa? And I've made sure that anytime I want to have sexual intercourse, I have protection. And I've been getting my protection from serikali, the Sure condoms. So niko na mia, food imepanda, I'm maybe using transport kutoka mali naishi mpaka kwa class. And then you're telling me to spend another 50 shillings or 70 shillings on condoms. It will not be a priority. Can we think considering the young people in your Kokoi community? Because for the longest time, and that is what is taking young people kwa streets, for the longest time you've been making decisions overlooking what is important for young people. You cannot sit in an invite-only conference and decide for an entire nation, 15,000 young people should now start thinking of where to get 90 shillings to buy condoms, whereas you people are the ones who are at fault in how you are spending your money, or rather our money. You cannot do that. Ni wewe, rais, wewe, CS mwenye umeingia leo wa health and all your CECs at county level, mkuje mkae na sisi vijana tuwaambie the solutions we want for our problems, because this is another monster you're creating. You're taking us to very dark ages. We cannot live without having condoms. Free condoms ni lazima. Wacha niwaambie nyi wasee, kaswende itatembea. Hizi maugonjwa zote zitatembea. HIV nakwambia, new HIV infections zitaenda juu. You cannot take this ati hii ni shida yao. Let them abstain if they want to get married. But in 2024, can you talk looking at the weather of the day, the climate of the day? That is not how young people are reasoning. Ndio maana wanaenda kwa street. Because even when they try to explain to you, hamtaki kuwasikiza. Nyinyi CECs, nyinyi we CS, President and PS wa health, tunawaita with all the cascos and everyone else who's in the health department. Can you come to this barazas? Today we are at our first Embu County baraza, where we are addressing these issues. Can you come to county level to mkuje we tailor solutions that suit everyone? Because you might be thinking you're solving a problem, lakini ni shimo tu unaziba, zingine zikifunguka huku. Unaziba moja huku, maji inatobokea huku kwingine. Pipe kama zingine 3 zinalipuka. Please don't take us to dark ages. We've done so much kwa ground to make sure that young people are focused on using condoms and taking PrEP and PEP. Sasa tunarudi mahali, sasa it is going to be optional for them. If it is optional, their partners are going to be at risk. People, not forgetting that married people also sleep with these young people. Chungeni sana. It is at your doorstep. Ni hayo tu kwa sasa.